session of the conference. And we'll be having oral presentations. Each presenter will have about 15 minutes to go through. 15 minutes is too much. Okay, let's make it. But the time is 15 minutes. Okay, so thank you for the clarification. There will be a 10 minutes presentation and a question and answer session for 5 minutes. Please, those who are around, we want to make this as snappy as possible. Let us know those the presenters who are around. Can you indicate please by raising your hand so that we will know what of those online? Can we confirm if we have those online who are going to give us presentations? Please, can you indicate by raising your hand? Huh? No, they can indicate by raising their hand. Okay, so because it doesn't make sense that we'll start and then start waiting again. Okay, so I think she can start. Okay, so let me give my co-chair the mic to say one or two things. So thank you very much.
Thank you, ladies and gentlemen. It's a privilege to serve us this afternoon, and we look forward to exciting presentations from all the presenters. Thank you. You have the floor. Can we please project a slide?
Good evening, everyone. My name is Adobe Mosaya. I'm from the Department of Clinical Pharmacy and Pharmacy Management, University of Nigeria, Nsukka. I'm here to make a presentation titled Students' Perspective of Doctoral Research Studies in Clinical Pharmacy, a qualitative study from in-depth interviews. Next slide. Background. Societies are presented with complex problems that require solutions. And these solutions are most times provided by research through postdoctoral or rather doctoral students. Over the years, doctoral studies have, both in developing and developed countries, have had a similar trend, and that has been delay in completion. For instance, in most African countries, it takes about 6 years to complete PhD studies, and in Nigeria, to be precise, about 10% of students complete their studies within the due time. Next slide, please. So the study objective was aimed at to assess the factors that influence timely completion of doctoral studies in clinical pharmacy specialization. Next. Methods. This was actually a qualitative study making use of in-depth interview. And doctoral research students were purposively recruited from the Department of Clinical Pharmacy and Pharmacy Management, University of Nigeria, Nsukka. The interview took place in September 2021, and they were asked just 2 questions. Did you finish your doctorate within the expected time? And secondly, what were the factors that affected your timely or untimely completion? In other words, if the response to the first question was yes, the next question was what contributed to your timely completion? And then if it was no, then he asked what contributed to the untimely completion. Then afterwards, data from the interview was subjected to reflective thematic analysis. Next. Results: 10 fellows consented to participate in this study from the department, and 5 themes were identified from the interview. First, contributing factors to the timely completion or rather delayed completion of the program. Secondly, contributing factors to the timely completion. Thirdly, ways to improve the program. Fourthly, advice to current students. And lastly, advice to prospective students. Next. 4 factors were identified as contributing to delayed program completion. First, delay in topic selection and approval, lack of sufficient study leave, financial difficulties, strike, and COVID-19 lockdown. Next. 5 factors also were identified to be a contributor to timely completion of the program. Funny enough, the same COVID-19 contributed to some people's timely completion, while in the previous slide, we saw that it hindered some people from completing the program. Then the remaining 3 contributing factors were rapport between the student and the supervisor's trust in the student, and support from department. Next. 3 ways were identified to improve the program. First was time management by the department. They suggested, as the interviewees suggested, that the department should make good use of time in running the program. Secondly, bridging the gap between pharmacists in the academia and in the hospital. And lastly, cost match according to the area of interest. For instance, someone complained that he was interested in pharmacoeconomics, for instance, as his research interest, and he realized that most of the courses didn't have anything to do with it, and he had to go an extra mile to train himself in that area. He got experts in that area in other universities. So he felt that it would have been better that people who, when you come in, your research interest is made clear, and then efforts are made to help you or nurture you in that your research area. Then advice to current students were just to mainly seeking support from experts and work-life balance. Then advice to prospective students were 3. Firstly, getting research for enrollment. I find this very interesting. Most of our programs in Nigeria, so when you come in, so you know 1 year has gone before you start talking about having a topic. But I know that in developed countries, some places you have to have informal meeting with your proposed supervisor even before you are admitted. And these things help a lot in completing the program on time. Then previous slide. Financial readiness was one of the advice they gave to people who are planning to start a PhD program, that they have to be ready financially. It's not something you go in unprepared financially. And then lastly, readiness for innovation and hard work. This was also very interesting because most times people go into PhD for different reasons, but this should be the primary reason for innovation, and the person has to be ready for hard work. In conclusion, the study showed some of the barriers and facilitators of timely completion of doctoral research programs in clinical pharmacy specialty, and points to ways those barriers can be used to improve postgraduate study program in Nigeria through policy and advocacy. Next, references, and then next. Thank you for listening.
Thank you very much, Adobe, for the presentation. I want to take 5 minutes for a question and answer session. Yes. Can one of you volunteer? Okay, please speak up.
The just observation now on the study objective. You put study objective. So I expect it to be objectives so that at least we are not expected to have just one objective. Then underneath, I see that you put aim. said the aim of this study, that's what to put under the objective. So just try to look at it and put it in order. Then I love the observation, the research gap created. It's a good one. Well done.
Thank you for that wonderful presentation, because the issue of finishing on time is a big issue in Nigerian universities, and it makes this research an interesting one. But the angle I didn't see you mention anything about. I don't know, probably it was an oversight, or I didn't hear you mention it. The aspect of the attitude of supervisors, because in many cases, people don't graduate solely because of their supervisors. I'm not ready to release you. So was there any finding in this area? Okay. Okay. Rapport with the student. Okay. So probably you didn't say much about that area. Maybe that was why I didn't really appreciate it. Thank you.
Thank you for your presentation. My question is similar to that of Doctor. Why is it that you did not bother to look into the aspects of students per se, their own involvement in either contributing to timely contribution, fulfilling their PhD on time, or delayed in completing their PhD? Involvement of the student per se. You didn't bother to go to that aspect, or?
Actually asked what, first of all, we asked, did you complete the program on time? And then the person answered, yeah. You now ask, what are the factors that contributed to the timely completion? So we didn't like, how will I put it now? We didn't make it explicit exactly. We wanted them to freely talk and tell us what are the things that contributed to the timely completion. So it wasn't specific to their own attitude or supervisor's attitude. No, we didn't find, yes, we didn't find that. Yes. Okay, there were people who didn't complete. That's why we had, one of the things was also factors that contributed to the delayed completion of the program. And there were 4 factors. Yes, exactly. Yeah. Yes. To be delayed. Okay. Okay, that's a good what you appointed that is actually can be a research, yes, a full topic for another research to look into the students' attitude. Thank you for bringing up that. Yes, the different aspects. Okay, thank you very much.
Thank you very much for your presentation. I observed your title says in-depth interviews, yet you asked only 2 questions. So I'm wondering how in-depth this in-depth interview you have done is, because I would have expected that you asked a whole lot more questions, which would have addressed all the issues that they've raised. So why did you decide on 2 questions, even though the study is supposed to be in-depth?
In depth is that it's true there are 2 questions, but we ask leading questions. I don't know how to put it. Like, if someone answers like the timely, the factors that contributed to the timely completion of the program, if someone is answering, there are some things that they will say you'd ask further questions for clarification. That's what I meant by in depth. It's not that we had so many questions to ask. I don't know if that qualifies as in depth interview. Okay.
Okay, you have a question. Please, give Dr. Kali.
Because I just want to, I look at the topic and compare it also just the keyword. And the word Nigeria appears in the keyword and not in the title. Because the title is looking a bit bogus. Student perspective of doctoral research study in clinical pharmacy. No one will have looked at it as if you want to study something that relates to more people in this field. And sample size says 10. So then the first keyword says Nigeria. So is it in this environment? Is it in Nigeria? I don't know whether you, so I'm just looking at that. Then of course, I think one of our panelists already said something about the fact that what in depth, because when you say 10 students that just read the story, one would like to know what is the bias for going into this kind of field, clinical pharmacy, because it's just one out of many fields in pharmacy. So maybe you should have also, maybe, I don't know whether you interview on that what is your interest in choosing this particular career? That can also be a motivation for why somebody wants to die there, to finish. Somebody may have a taste of it and say, no, I'm not doing again. And so I think maybe in the subsequent study, which would appear in the conclusion that possibly this is just a taste of this kind of study that can expand future study. Thank you.
I think I have two contributions to this. You know, the beauty of presenting an abstract in a conference is for you to enjoy free peer review. So the things they would have told you when you write all the things in journal, I think you've done well. And when you see it, you want to close it out of anger. You will enjoy it here. First is what they told you about. In that you mentioned in that interview is a clearly defined qualitative methodology. I don't think it's necessary that you should say two questions. Since you mentioned that you asked leading questions and you followed up on some of the questions, so don't mention that you used only two questions to do in-depth interview. That was one. A potential limitation which you need to look at, but if it is possible to recruit more, is the sample size. How were you sure? You know, there's something they call data saturation. Okay, data saturation is such that if you interview 20 people, by the time you're interviewing the 21st person, he's essentially saying what the first 20 people said. If you interview 5 more people, they are essentially saying the same thing. That is, no new ideas or team has emerged, because some journals might insist that you tell them whether you achieved, how you achieve saturation or data saturation before, and that is usually expected in qualitative study before you proceed with your analysis. That's to show so that there's nothing new or no new teams are emerging from the study. Alternatively, too, is it appears there is a bias. I don't know what the balance is. Let me just make this comment that much of the people who were interviewed were those who finished on time. I don't know, the voices of those who did not finish on time is not very prominent in your results. No, it's not prominent. So one of the things that will help also is each of these factors that you mentioned, those that are for, you give the representative, you understand, not percentage, just statement they made to say this is what they mean. It helps in also speaking in the participants onward. But by and large, I think is a very good presentation and a wonderful attempt. So if there are no more questions, I think we can give her a round of applause. Thank you very much. Okay, so do we have Frank? Okay, please.
Okay, thank you. My name is Franklin Kenechukwu. I'd like to make a presentation on enhancement of in vivo anti-malaria activity of artemether by clotrimazole against sensitive and anchor strains of Plasmodium berghei. Next slide. So that's the presentation outline. Next slide. Malaria is a life-threatening disease that is caused by Plasmodium parasites, usually transmitted by the mosquito, the Anopheles. And at least half of the world's population is at risk of this malaria. Africa region accounts for approximately 90% of the cases, as well as even 90% of the malaria deaths, according to the World Health Organization. Cerebral malaria is the later complication of the severe Plasmodium falciparum infection. The artemisinin derivatives are the most effective drugs for the treatment of the cerebral malaria, usually parenterally, and they're able to reduce the inflammation of the brain that is usually induced by malaria. And the use of artemisinin derivatives is now being threatened by drug resistance and other challenges associated with this. So the best treatment for uncomplicated malaria is usually ACTs. That's the World Health Organization recommendation. However, the 3-day regimen of the ACT usually poses a very great challenge, especially in rural areas where most of them don't complete the treatment. Next slide. Then drug resistance and other challenges associated with malaria highlight the need for development of effective agents, and then for adoption of other strategies and approaches to treat malaria effectively. Now, drug repurposing in recent times has been looked at as one of the approaches that can be used to develop new ACTs for malaria treatment. And drug repurposing entails finding novel therapeutic indications for already approved drugs. So in this case, we exploit the non-antimalarial medications that are already in the market as a source of treatment options for malaria. Advantages of these approaches include low cost, reduced risk of failure. You don't need to start developing a new drug, shorten drug development process, and then drug discovery. Clotrimazole, for some of you who are very familiar with the drug, is an antifungal drug, but recently it has been discovered to possess antimalarial activity. Some researchers have even gone ahead to formulate it as a nano-emulsion, and they have reported improved antimalarial activity using that clotrimazole and then the nano-emulsion formulation. In vitro, some researchers have explored the antimalarial effect of artemether, of artemisinin, and the repurposed antimalarial drug, that's the clotrimazole. They have established in vitro that the combination can exhibit synergistic antimalarial activity. Next slide. So having established that in vitro, we want to find out what will happen in vivo. And that leads us to this study. The objective of the parent study was to study for the first time the in vivo antimalarial activity of artemether and then clotrimazole combination using the mice model. The reason for this is that at times you may establish a bioactivity in vitro, and when you tried it in vivo, you might get a different result. Then in this study, we used 2 different strains of the malaria parasite. We used the sensitive strain, which is the AK65 of Plasmodium berghei. Then for the resistant malaria, the cerebral malaria, we use the resistant strain, that is the anchor strain. And for each of these strains, we used 5 groups of animals, and then each of them contains 6 animals. So we have a total of 30 animals for this particular one. And then for the resistance strain, we also use 30 animals. Group 1, we are administered with a therapeutic dose of artemether. Group 2, we administered them with the therapeutic dose of clotrimazole. Group 3 received the combination. And this combination, we just explored the established ratio they used in vitro that gave the synergistic anti-malarial activity. And then we also compared it with a commercial sample, an SCT we have in the market, which is a combination of artemether and lumefantrine, which is the common one. Presently, we don't have a combination of artemether and then clotrimazole. And then we also have the negative control, which receives just the distilled water for the sensitive strain that was administered for the sensitive strain, where we administer these animals orally. Next slide. But for the resistant strain, we administered these combinations parenterally. And then we use normal saline as a negative control. And then we still maintain the groups 1 to 4. Next slide. And then this is the result of the mean percentage parasitemia of the mice that were treated with various samples for groups that were infected with NK strain, that is the sensitive strain of this malaria parasite. You can see there was a reduction. We have the post-inoculation, that is after the establishment of malaria in the mice. And then after administering the samples, we now checked whether there was a reduction in the parasitemia. For artemether, we recorded a reduction in parasitemia, which was higher than that of the clotrimazole. Clotrimazole was just used as an adjuvant. And then the combination gave a higher antimalarial activity compared to these two. And even the antimalarial activity was higher than that of the marketed formation we have in the market. For the negative control, the one that received the BC water, there was a hyperparasitemia, as you can see there. Next slide. The sample was also established for the resistance strain. Only that in this resistance strain, there was the antimalarial effect was reduced, so which could be attributed to the resistant nature of this strain of the malaria parasite. So for the artemether, which is commonly used for the cerebral malaria parenterally, then we got we had a good antimalarial activity. For clotrimazole, even though it is an adjuvant, it still recorded mild antimalarial activity in the sensitive and the resistant strain. The combination gave a higher antimalarial activity, which was even higher than the artemether injection, which is the one they use in the market for cerebral malaria. And then for the normal saline, there was hyperparasitemia. Next slide. And then the PCV, that is the packed cell volume, which is also a parameter one usually assessed, where the hematological, one of the hematological parameters you assess, you use to assess the antimalarial effect. So we established the baselines for the various groups of these animals. When we now infected the mice with the malaria parasite, there was sharp reduction in the PCV levels for all the groups. Then after treatment, for those groups that received these formulations, there was restoration of the PCV levels. Unlike the negative control, which is the one that received the basic water for the sensitive strain, there was consistent reduction in the PCV level. Next slide. Then the same thing was also recorded for the anchor strain. So the PCV level was reduced after the inoculation, which is an indication that these animals are malariogenic. So they are suffering from malaria. Then after treatment, the PCV levels was now restored within the normal range. But for the one that received the normal saline, there was consistent decrease in the PCV level, which means that particular group of animals, they are still malariogenic. Next slide. Then for the hemoglobin concentration, we also try to establish the baseline. Then after inoculation with the malaria parasite, there was sharp reduction in the hemoglobin concentration. Then after treatment, the hemoglobin concentration we are restored within the normal range for the samples. Then for the one that received this water, there was consistent reduction in the hemoglobin concentration, which means that those group of animals, they were anemic. Yes, the next slide. Something was also recorded for the anchor strain. Then the next slide. Conclusion. This is the preliminary studies we have carried out on the grant we are working on. So this study has shown that clotrimazole enhanced the antimalarial activity of artemether in vivo for the first time. And then the artemether clotrimazole combination at this ratio, which they used in vitro, gave higher in vivo antimalarial activity than the marketed artemether lumefantrine for the uncomplicated malaria. And then from the severe malaria, that is the cerebral malaria, it also gave a higher antimalarial activity than the artemether injection, as against the sensitive and then the resistant strains of the Plasmodium begay, respectively. So the combination will be a potential therapeutic option for uncomplicated malaria treatment, and then could also provide an alternative treatment option in cerebral malaria. Next slide. We thank the SKG Pharma for generously providing the clotrimazole pure sample used in the study, and then the May and Baker PLC from Lagos, Ikeja, they provided the artemether pure sample which we used. We have to also appreciate the TED Fund for awarding the NRF grant for this study. This is just the preliminary aspect of the work, which is ongoing. Next slide. Thanks for your attention.
Thank you very much. Please, let's give him another round of applause. So we have just listened to his presentation on the enhancement of in vivo anti-malaria activity of artemether by clotrimazole against sensitive and anchor strains of Plasmodium begay. So I think we'll now go into the question and answer sessions. Okay.
Well done for the presentation, sir. Please, my own is not really a question, just a clarification, because I don't really have a good knowledge of what you are saying. But the question I want to ask is that I think what you are doing is you are trying to come up with a drug, comparing the drug with a pharmaceutical drug, and from what you said, the drug you came up with, you tested it on mice. The question I want to ask now is that, does mice have malaria? At least if do they have malaria? Because if they have malaria and you use the drug, or then you can know that, oh, it works. So that just
Thank you very much, Mr. Presenter, for the presentation. In your slide, you wrote Wister mice. I know Wister rat, but I don't know Wister mice. So I want you to verify that for us. Then, secondly, in your abstract too, you wrote histopathological studies on liver and kidney, and you did not give us any presentation on that in your slides.
Thank you, sir, for the presentation. Of course, just like you said, the clotrimazole antifungal in nature, and then artemether lumefantrine anti-malaria. And if, of course, for the objectives, you said one of it is that you want to provide alternative for drug like the complicated malaria, and then probably a substitute for uncomplicated malaria. And of course, you have induced Plasmodium vaginae in the mice,
But one we may want to ask, because the artemether-lumefantrine, like you said, has such synergistic activity that one could position that both the drugs have targets for the malaria in question. However, for clotrimazole, I want to ask whether the clinical report to support that clotrimazole demonstrates anti-malaria activity that actually provides such rationale for us to look at it, that if we go into trial in the animals, because we know that even Plasmodium vaginae will not behave exactly like the falciparum. And so as experimental study, one may want to look at it that, okay, for clotrimazole, if we employ clotrimazole with artemether and then compare to artemether-lumefantrine, can one actually have such insight that we want to provide such a substitute? Why? Because clotrimazole has no such effect that is direct for anti-malaria compared to lumefantrine. And so what are the chances of such substitution? I don't know whether I'm communicating, sir. So maybe I should just stop there.
Okay, thank you so very much for your wonderful questions. That is the essence of this conference, for people to make inputs, ask questions that will add color to the research you are doing. So as I said earlier, this is an ongoing study. Yes, this is an ongoing study which was just the preliminary results we obtained from the NRF grant. Actually, the grant awarded by the Nigerian government was to develop a nano-sized, novel nano-sized combo therapy for malaria. Novel nano-sized combo therapy for possible treatment of malaria. So, and this novel combo therapy, according to the World Health Organization, don't use single drugs for treatment of malaria currently. So the ACTs are the ones that are currently in use. The ones that are already in the market, we are getting concerns about them. That's why we are looking at alternative ACTs. And I have to start from the person that asked question here. I don't know you are disciplined. I don't know you are disciplined, but if you are in biological sciences, yes, you know that that there's what we call the models for evaluating pharmacological activities and bioactivities. You don't just, when you are in the preliminary laboratory stage, you combine, you prepare something, you administer it straight on human beings. So you have to start from the in vitro studies. You move to the animal models. And when you come to the animal models, there are various animal models used to evaluate various diseases. Yes, and how do you do that? You try to simulate what will happen in humans. No, I'm trying to educate you. Something like diabetes. Rats, for example, they don't suffer diabetes, but we can inflict, we can cause. Mice don't suffer from malaria, but you can use them. You can infect malaria on them experimentally, and now try to see. Yes, you can see inoculation. You get malaria parasites, and now, of course, they will show signs of malaria. Then you check whether the malaria parasite has actually established in those animals. First of all, you have to check the blood of these animals first. You now see that there's no element of, that's why we establish the baseline. Before you can now infect them with the malaria parasite. And now you have to leave them for some time and check whether the malaria has actually established in them. and you will see them shivering and demonstrating that signs of malaria. So these are experimental models they use in biological and allied sciences. So mice per se, they don't suffer malaria, but we can use them, we can inflict malaria on them, and now you use them to now assess the antimalarial effect of formations in animal models. So when they pass all those animal models, you can even move to a higher animal before you go into the clinical trials and use the human beings. So that's your question. Before I come to your own, then my friend Kale, thank you very much for your question. You asked whether the combination, whether there has been an established clinical, yes. In fact, that was the question that when we went to defend this the proposal at TED Fund, that was it. And we showed them the publication. We came with the hard copy. And they were convinced before they now awarded this grant. So people have carried out in vitro study where they established that clotrimazole, even though it is an antifungal agent, it has been established to possess anti-malarial activity. And it has been shown that it works on the hemoperoxidase of the malaria parasite. It has an established mechanism by which it exhibits that antimalarial activity, which is quite different from that of the artemisinin derivatives. So that's the basis for trying to combine them to see whether, since they have different mechanisms of action, when we administer the two of them, are we now going to have the two drugs acting at different sites different sites are now exhibiting the synergistic effect. Then coming to, I think that has answered your question, or do I? No, I didn't get the thing. There are two studies that have been carried out on this using the clotrimazole. One was that of the in vitro, which I told they use Plasmodium falciparum. Mm-hmm. They've also gone ahead to formulate even that clotrimazole as a nano emulsion to enhance the antimalarial effect, which they even used animals. And they were able to establish an enhanced antimalarial activities on those animals. These are the basis by which we now try to combine. We have been, in our group, we have been working with artemether and other combinations. But now we are now trying to see whether we can get repurposed drugs and now combine them. And we have seen, based on the previous scientific evidences, so that's why we're now trying to combine these two. Yes, in vitro and then in vivo in a low animal. Yes. Yes, as I said, it's an ongoing study. Yes, it's an ongoing study. In fact, this is just the preliminary aspect of the work, which we just combine them to see what we get before we can even move into getting a nanomedicine, which is our target. So that answers your question as well. We have established, we also carried out histopathological studies, but unfortunately, I didn't present it here. It was not because I was looking at the time that was given for the presentation. So we have established that the combination doesn't have a toxic effect on the kidney and then on the liver, which are the two major organs implicated in malaria. So that is now the basis why we now want to go ahead with presently we have formulated the nano medicine. So we are going ahead to evaluate and now check carry out other studies on it. So I think okay, Mr. Sorry, that should be albino mice. That was what we used. Albino. You don't use Abdul. So what do you use? Sorry, sir. We are here to learn. Okay. Well, I don't know. The mice we used, it was in faculty of veterinary medicine, I mean pharmacy. So I want you just to go there. So if it is the Western mice that they used, I mean mice, and then Worcester rats. Okay. All right. Thank you so very much for that. Okay, you have a question as well.
Thank you for the presentation. It's a good work and we are learning. I don't do malaria research, but following your presentation, I'm just curious to know, is there any association between PCV levels and malaria? If yes, the result shows between all the groups treated with the anti-malaria drugs, either the combination artemether, lumefantrine, market commercial one, doesn't show any significant difference in the PCV levels of all the treatment except the negative control. And if you look at the mean parasitemia, there seems to show significant difference. So if there is an association between PCV levels and mean parasitemia or malaria, there needs to be clarification in that result. And my second question is that you are talking about malaria, but you concluded with cerebral malaria. So I'm just curious to know that, does this have effect? Because if you are talking about cerebral malaria, most likely it means, I'm not sure, most likely it means the parasite crosses the blood-brain barrier into the brain. So are you projecting that the combination may also get to the brain to treat cerebral malaria, so that's why you are making that conclusion? Thank you.
Okay. Thank you very much. I have to also start from the last question, whether I'm projecting that this, what we have will can be used for the treatment of cerebral malaria. Just as I said, this is just the preliminary studies, and then there are we have the various strains of this malaria parasite. We have the sensitive strain, we have the resistant strain. This resistant strain is the anchor strain, which we obtain from the medical research institute in Lagos. So the resistant strain, which is usually the one that is used to assess the cerebral malaria model. Whereas the sensitive strain is what one can use to assess the uncomplicated malaria. And artemether injection, we still have quinine and then some other drugs that are used for injection. They are used to treat this cerebral malaria. Whereas the ACTs, they are used to treat the combination. So now, you cannot say actually now that this formulation will be used to treat cerebral malaria. There are further studies that one need to perform before you can now establish. What we are saying is that this could be a potential combination that one can explore other studies to verify whether it will be actually selected for the treatment of the cerebral malaria. Then the first question is on the PCV, and then yes, that's what you call the hematological parameters. Once you're assessing this anti-malaria effects, you also check the effect of the formulation on those hematological parameters. One of them is the hemoglobin, and then the PCV. So if someone is having malaria, there will be a negative effect on the PCV level of, if you check the blood, the hematological parameters of that person, there will be a reduction from the normal level. Something with the hemoglobin, which can cause anemia. So these are things that now exhibit as the clinical, signs and symptoms. So that is why we use this. Further statistical studies need to be carried out to now check the level of significance between the PCV levels and then the hematological and the hemoglobin concentrations for those various combinations. I mean, for the various samples. I think we are going to carry out that one before we get it out. Thank you very much.
Okay, thank you very much for the presentation. I have one other question or comment. So the question is, you have mentioned that the standard of care in the treatment of malaria is the use of artemisinin-based combination therapy.
Yes.
And as a clinician, you want to propose a drug that has already been used, an antifungal agent for the treatment of malaria, and you combined it with an artemisinin alone. I didn't see a combination of artemether lumefantrine, clotrimazole as a group, because that is what I'll be thinking. Can addition of clotrimazole to the regular artemether lumefantrine give me more and better results compared to what artemether lumefantrine? That's what the clinician will be thinking, because that's the only way you can sell, because the proposing of that drug to me, and I know it's not expensive, so they might not change the price by more than 300 or 500 if you add clotrimazole to the current artemether lumefantrine combination. So beyond the using the nano, is it nano?
Nanomedicine.
Changing it to nanoparticle. If it works, I won't mind combining it with the regular artemether lumefantrine and giving it to patients, and to see, as long as we're all interested in achieving better results. So what do you think? Thank you, sir.
Okay, yeah, thank you very much. That's the essence of the conference, and it's a very good idea. So you are talking about a triple action drug. Yes, we already have some triple action drugs that we have in the market that usually used to treat malaria. So I think that's is a very good idea, and that one can also try to look at that. But that will also involve a different, additional work. So which will be outside the scope of this present grant.
Thank you very much, Dr. Franklin Kerechuku, for your wonderful presentation. Please, let's give him a round of applause. Please, let's ask those online. Has anyone indicated that they have any question, please, so that the next presenter is supposed to be Dr. Yes. Okay. So please, is there any other presenter around? Whether online? Okay, look at the information. And he said he's tired, he won't be able to present. So, ladies and gentlemen, the first technical session has been an interesting one for all of us, and standing on the authorities of those that gave me this microphone, I want to honorably close this session. Thank you very much, and God bless you. Out of the cocktail.